everyone. I am Dr. Megha Chadha from Patna. Do you know that our state Bihar is not in the pink of health? According to WHO's dashboard, the prevalence of anemia in women of reproductive age in India was 53% in 2019. That is the fifth highest globally. Now, what do we even mean by anemia? Anemia is a condition in which the number of red blood cells or the hemoglobin concentration within them is lower than normal. Normal hemoglobin levels during pregnancy should be more than 11 grams per deciliter and more than 12 grams per deciliter in case of non-pregnant women. Conditions that lead to anemia may include heavy periods, pregnancy, ulcers, a diet which is deficient in iron, folic acid, or vitamin B12, blood disorders, problems with iron absorption, etc. The most common type of anemia is iron deficiency anemia. Anemia mostly produces symptoms like fatigue, weakness, dizziness, pale skin, and shortness of breath. This happens because of decrease in the capacity of the blood to carry oxygen to the body's tissues. Anemia in pregnancy can lead to dire consequences. During pregnancy, it can increase the risk of preterm labor and delivery, high blood pressure, intrauterine death, infection, and bleeding during pregnancy. During delivery, it can prolong labor, increase the rates of operative delivery and induced labor. It can also result in fetal distress or problems related to the placenta. After delivery, there are risks of excessive blood loss and infections. It also shows risks of failure to produce milk, depression, slowing of the process of uterus resuming its original shape. Anemia in the mother can impact the baby as well. The baby could have low birth weight or could have increased risks of infection, anemia, and abnormal cognitive development. Pregnancy is a demanding physiological state. Additional foods are required for weight gain in pregnancy and birth weight of infants. The mother, as well as the growing fetus, needs iron to meet the high demands of RBC or red blood cell formation. Folic acid taken throughout the pregnancy reduces the risk of congenital malformations and increases the birth weight. The pregnant or lactating woman should eat a wide variety of foods to make sure that her own nutritional needs as well as those of a growing fetus are met. Though it is possible to meet the requirements for most of the nutrients through a balanced diet, the extra demand of iron is often unmet. And thus they are advised to take daily supplements of iron, folic acid, vitamin B12, etc. The National Iron Plus Initiative recommends iron and folic acid supplementation every day for at least 100 days, starting from the first trimester at 14 to 16 weeks of gestation for all non-anemic pregnant women, followed by the same dose for 100 days postpartum. The best way to take iron supplements is as follows. You should avoid taking iron supplements along with caffeine-containing drinks like coffee or tea, along with milk or milk products, along with antacids, or along with high-fiber foods such as whole grains, raw vegetables, etc. Instead, you should take your iron supplements with a glass of orange, lime, or lemon juice. You should take it as prescribed by the doctor in the correct dosages. And you should take it with a small amount of food or at bedtime in case of upset stomach. In case of any side effects with iron supplements, you should inform your doctor, especially if you experience nausea, vomiting, constipation, or diarrhea. Black stools are normal, but if they are accompanied with blood or with abdominal cramps, then you must speak to your doctor. And do not stop taking any medicines without informing your doctor. Remember that you and your baby need to be healthy. So please take your iron supplements and be in the pink of health. Thank you.